Hi everyone! Today I'm going to talk all about something that I see happening often in birth. Sometimes a provider will put soap or disinfectant in the vagina while a baby's being born, or crowning, for example. In this video, I'm going to tell you why it happens and how to protect your body and your baby. My name is Jenny Kula, and I'm a holistic doula, childbirth educator, placenta specialist, and mom of 4. And I'm here to help you follow your own compass in birth. Let's start making birth better together. So, this topic of soap in the vagina and birth. So, what does it mean? Something that I see sometimes in birth is when a parent's giving birth, their provider, their doctor, or sometimes their midwife will open a packet of usually some kind of liquid soap product. Sometimes this is a disinfectant surgical type soap. Sometimes they even will use betadine, I've seen. I've also seen them use like a Johnson's baby soap. That type of soap or shampoo, disinfectant, any of those things. And what they do is they pour it onto your vagina while your baby's crowning and being born. And it's really not an evidence-based practice for anyone to be doing this. And we're gonna go ahead and talk about that in a minute. I typically see this done in some of our area hospitals, usually not done by midwives or out of hospital births, not done at birth centers that I have seen. And it's really interesting because other areas of the country, certain places we see this practice happening more than others. I don't live in a super progressive area, so it takes our providers here a little bit longer to catch on to evidence-based practices for birth. So, you're probably thinking, I've never heard of this before. You might not even know that it happened to you. And this is because at the time when your baby's crowning, you are at your most vulnerable point in birth. You're at your most spiritually open point. And you are so in your birth zone, and the intensity is such that you're just focused on connecting with your baby and bringing them earthside. And for a lot of parents, they may or may not know that this is happening, but the intensity of the moment, it doesn't really matter to them. But I think you deserve to know that this is something that's out there so you can decide for yourself. So why do providers put soap in the vagina at birth? Why is this happening? I feel like my 6-year-old saying, what is the reason? What is the reason for this? So one reason why they do this is that they often believe that it is for disinfection purposes. So they think that by killing the bacteria of the vagina, that there's no chance that the baby could pick something up on the way out. But this is not an evidence-based practice at all, and an important 2018 study showed no benefit for parents or babies with these vaginal disinfection procedures. So another thing that they say that this is for sometimes, because I've talked to different nurses about this, they feel that it helps with lubrication as the baby is coming through the vagina, and it helps the tissues stretch and lubricate so that baby could be born more quickly. However, ask yourself this: would you ever use soap as a lubricant? Would you ever choose to put that in your vagina as a lubricant? I would not. Absolutely not. It actually does the opposite. It's meant to carry particles away, which is why soap cleans things and can disinfect things and whatnot. So it's pulling away all of those naturally produced lubrications that would be helping your baby on its own move through the birth canal. And when they do this, it's so interesting because I've been at births before as a doula where I've had the nurses come in and they've got their Johnson's & Johnson's baby soap and they joyfully say, "It's time for the slip and slide." And they have a sponge and they suds everything up and the whole room just stinks of Johnson's baby soap. And, they really work it in there. It's incredibly intentional. It's very strange and bizarre and not evidence-based at all. Some people say that the purpose of this is also to clean the baby's head as they're coming out. I have another theory about why it's done. So I found some research that showed that this practice actually could be evidence-based from a 2017 study for preventing infections in cesarean birth. It was shown to reduce the risk of endometritis infection after a C-section. So, and this is especially where you get into the betadine cleansing of the vagina and all of these things. So they found that it reduces the risk of infection in a cesarean to do that. So here's the thing. So many of our hospitals have, and I see this practice happen in hospitals that have very high cesarean section rates. So let's put this together for a second. So if this is an evidence-based cesarean birth practice, right, then they're carrying this over potentially into a practice for vaginal birth as well that doesn't have any good evidence to support doing it. So that's just something that I wanted you to think about. This is part 1 of this series where we're talking about why providers put soap or disinfectant in the birth canal. Thanks, everybody.